That hurting you, sir?
Hmm?
You all right?
I get fidgety constantly.
Yeah. You see, you feel it touching the bottom, like it's getting full?
No, not yet.
So overall, pain point of view, your pain level is worse than it was before the surgery.
Once it feels like it's not taking anymore, and you feel like you've filled the void, just you can stop. It's just gonna be, it's gonna try to push it out. Okay. It should be every 48 to 72 hours. You want to change the dressing and assess the wound and measure it, feel your depth. The issue becomes the rough
You
debris.
can take the tweezers and push it in and see how much
Say
further you need to
48
go.
hours from now, we change the dressing, and you take a curette and you want to measure the depth. You have to be very gentle with that because you could have just a micro tissue healing going on at the very base of your wound, and you disrupt it with a vigorous curette. So take your measurements very slow and gentle, and if you feel it stop, don't force to try to see if it's any deeper because tissue, can be very, very friable at that point, very fragile. So you don't want it to break, and then you're like, oh. So it's a gentle process as it heals. But we want to make sure. The reason why we make sure that foam is all the way to the base is if the tissue would heal and leave an open cavity below the healing tissue. You really want this to heal from the base and close up to the surface. If it closes just above the base, then you have this cavity that can fill and become an abscess. So it's really important to have the foam touching the base of the wound so that we're pulling tissue from the base and the sides and we're closing it almost like a zipper from the bottom up.
Okay.
Feels good?
Yeah.
Okay. Then when you let go, you're gonna have to let go eventually. Just
Okay.
let go for a second, see if it pushes out. That's all right. That's fine. It's not gonna push all the way out, right? It seems like it's gripped right there. Okay, good.
Yeah.
All right, now we're gonna cut our track.
So use this one.
Yeah, use the long one. Just cut a nice long. You can even take the side. Just cut it now. It's up to you where you want to put this track pad. Are you going to be just laying in bed healing for a while?
Mainly, it's just
Yeah.
the walking I'll be doing is like from my bedroom to the bathroom. I got a 40 by 26 house. Bedroom to bath, bedroom to living
Gotcha.
room, nothing like that.
Okay,
That's
that's fine. What we might do is take two pieces. We'll take one and then two. We'll go this way, and we'll put another one here.
Okay.
But what we're going to have to do after you cut that, that'll be your first
And this is
step.
about the good size.
A little wider, about 2 inches. Yeah, about there's good. Yep. Has to be about as wide as this circle, this track pad. We want to make sure that when we put this down up here, that it's got enough foam
Cover.
to sit on. Yeah, to sit nicely on and get a nice suction, and it'll suction all the way down to the tip. Okay, cut another piece, just
Same
like that,
length?
same length. Yeah. We can always shorten our length. Length doesn't really matter. It'll follow the trail of the foam. We just have to make sure that all our foams touch. And after you're done, I'm not going to touch your foam. Yeah, move your foam off, and we're going to have to get the drape.
So this one's garbage now.
Yeah, I mean, just keep it around. Don't throw it away. You never know. We might need it. Who knows?
Use it again.
You never. Yeah,
I mean,
it's
it's
not
the same size as
It's yours as long as
everything
it's not patient to patient
Can you
transfer.
use that to put in the wound?
Yeah,
Is
you
that
can,
cut
you
to
can
size?
keep all your foam. You
Okay.
have plenty of supplies. You don't have to worry about conserving
Okay.
supplies.
That's what I was looking at that box.
Yeah,
I
no,
said,
you got plenty of supplies. This is
Oh.
for a good couple weeks of supplies here.
Okay.
Okay, so then take one. You put that over there. Get out of your way,
This one?
and take one sheet of that blue striped stuff. Pick it up. What we're gonna do is with drape. You can don't open anything yet because we can cut it. All these little arrows that you see, you can cut the drape in those arrow lengths. So what we want to do is have something on his skin that's going to prevent the foam from macerating the skin below it. So a contact layer. So what we'll do, we'll take a strip of this drape, just cut a long strip of this drape, okay?
Yeah.
And we're going to put that down first, right over the skin. Now that, we can actually get a little bit of vac
Okay.
on that.
I
If you,
gotcha.
you know, I think that just putting the paper over that might be okay. I don't think we're going to. That's a tough thing because it's not really deep enough to put a foam
Right.
on it. You could lay a piece there if you
Yeah, I was
want.
thinking part of
You
the
could lay
bridging.
you could lay a piece, yeah, part of the bridge. But the problem, yeah, what I would do is then start your drape to prevent maceration right at the edge of that wound. Okay, and we're going to run it right up here. So cut it all the way down a long strip. Here, you can
So
fold
right
it
now-
fold it in half first. It'll be easier to cut. Fold it in half. And then
basically
start at
cut
the
out
big
one
part
of these
here
guys.
and just cut it straight up like that. Yep. Just so it's wide enough that we can. There you go.
Yeah.
There's your template. So you're gonna go straight up at that
I
level.
need to hang over so it can stick down, right?
No. This is just for the base. This is just to put the foam
Underneath.
on top of.
Okay.
We're gonna put the foam right on top of this,
Okay.
so it doesn't. So his skin isn't gonna be sucked on by the foam. So it's gonna be 2 layers of drape. The first layer of drape is to protect his skin, the good skin. We don't want that being
Okay.
hit by. So then you got the 1.
So this one.
So you look at your 1, man. So that 1,
Yep.
you peel it. See where the arrows go?
Yeah.
Just go ahead and peel the 1. And that's going to be your sticky side. So you can feel this is real tacky.
Mhm.
Oh, okay.
And then you're going to lay that down.
Like a Band-Aid
I'll
when
tell
you
you
pull
what.
the paper off the
No, leave that
Band-Aid.
alone.
Okay.
You're going to put that. What we're going to do is I think we should probably cut this in half too because we're going to change our direction.
Okay.
So probably cut it in half again. So we're going to make like a little floppy L like that. Just the shape of a relaxed foot. That's sticky because I already did the sticker. Could have done that beforehand. So.
Okay,
All right.
Okay.
take another piece.
So now, take that 1 and the edge of this sticky part, put it right up to the edge of that wound, not over it, but right on it, because then it will block our suction.
Right over it.
Right? No, right
Yeah,
at
right-
the edge of
right
it,
up
right
to-
there. Yep, right there,
All right.
right to the edge of the wound.
Where the icky and the good come together.
Correct, right on that juncture, and then just flatten, press it all down nice and easy. Just use your hand, just press it all so it sticks to his skin.
Okay.
Now it's not sticking so good. Not sticking better. Good. Okay, and then lift up the blue tab, and you'll see there's another number 1 underneath there. And pull that number 1. It's got an arrow. Pull it up that way, yep, and then just lay it down. No. That way. That goes that way. Lay that all the way down. Yep, good. It's got some dry
A lot of
tissue.
dry
Yeah,
It's
very
not,
dry.
Wondering if we could. Do you have a like Cavalon or benzoin, any type of a
Yeah,
skin prep?
benzoin. Yeah.
That would help with that tissue because he's not. It's
Alright.
not even grabbing his tissue right now,
So,
is it?
no, right here it's not.
Yeah, it's just
Tom, if
peeling
you
off.
can grab some benzoin, it's in the one of the.
And pull the 2 across,
Got it.
and then the blue tab just peel. The blue tab's just there as something to hold on to peel the 2 off. And
Okay.
you just tear the blue tab off.
So 1, and then 2.
Yeah. And
Okay.
the blue tab stays until you do the 2. It's just like a
Okay.
holder. And
Got
do another strip like we just did. Cut another piece just like that one. So you could probably cut this in half. This piece. Yeah.
So here and then go across.
Open it up. Open it up. Open this up. Sorry. Just cut it right in half, and then do that same size strip we just did.
So you want a blue on one side and a blue on the other side.
Yeah.
Okay.
It's just and however you do it, doesn't really matter as long as we're covering his skin. Wait, we're doing one more up here, right?
Yeah.
We're gonna do that. Yeah, see,
So
just
should we do
the
it
thin one again, the thin thing again. We just want it thick enough to cover the foam.
Okay.
And the last piece is the piece you drape all the way across.
Okay.
And we'll have to
All right. So now
do
we're
your
gonna
1 on the bottom.
down the bottom.
That's sticky. That one can go down.
Do I have to cover this one up?
Yep, you try to touch all
Like at the
aspects.
corner.
Yep, exactly like that. Yep. And then,
Now we're going to lift the one up.
now, if you want to keep it off his hair of his leg, you
That
can
don't
just
matter.
peel the one. Well, you might not want to pull it off. Go ahead. And then before you do the 2, you can always just cut this. Done either way.
Yeah, I mean-
okay.
I
And
used
just
to
pull the
I
2.
used to play
Pull the 2.
baseball and I had
wait,
my
go
ankles
just the
taped.
2. Now hold the blue down
Yeah.
and pull the 2 back. Stop. Pull the 2 across.
Oh,
Hold the blue and pull the 2 across. There you go. 1, 2, blue. And then
One,
just peel
two,
the blue.
and then rip blue off.
So you put the second piece where the first piece ended.
Yeah, you want to cover it. What we're doing,
Like
we're gonna
overlap it,
all this
just
whole
the
thing we
top.
just did is just to protect his skin from the
Right.
suction.
Okay.
Now we're going to put our foam down.
Okay.
And this is where you're going to do a little thicker piece. So you probably use that whole piece. Okay.
What's the diagnosis?
Coalition.
So they didn't give me paperwork.
I put it in. I gave it to
People, when you put a vac on like this, because he's gonna put the foam here.
Well, we have my son's
Okay, yeah,
home
because you're
too.
not gonna go
So.
to lay it. It's gonna take someone. I'm gonna have to hold. Yeah, that won't. I'll be okay. We're gonna take that piece of foam
Yep.
and put it on top of this foam
Okay.
and run it right on our plastic, but bring it up so it kind of doesn't hang over the edge there, like that. You know, just like that. Okay. And now this piece, you're gonna open up this one. Okay. Yep. And as you come across, don't pull it all the way off. Just sorry. We're gonna have to put the drape. Just don't want this stick.
Yeah.
Yeah. So you can hold the top of it
Future
there
reference,
No, I
just
got-
take it till the edge, but don't
to
pull
the
it
edge,
all
so
the way
then,
off.
and then lay it down. So now hold that. Yes, Gian.
Okay. Does he need to prep both sides of that with the Benedine prep?
I don't know if he's gonna. We're gonna have a
With the
lot.
top seal?
He could. I mean, if you want to benzoin this whole area on each side, because you're gonna have some drape touching his skin, it's gonna try to really need it to stick. So it wouldn't hurt, I guess, if you have another stick here. You've had
Hold that.
skin that doesn't. Things don't stick to your skin.
Well, it's just dry.
Yeah.
The foot has been swelling
Yeah.
and retracting
Cracking.
so much that the skin is
hmm
just getting too dry.
Yeah.
I mean, as you can see.
You can just do it. You can move the foam out now. Just move the foam out for a second. Just do it right along the edge there.
That, I was just wondering because I know you got to have a good seal on the top of it.
Right.
And that's all I was asking if
Once
it
we
was-
draw it down, it's going to suction down on top of it pretty good. So
Right.
But I
It
appreciate-
should just basically like a true vacuum, plastic bag.
just like the clothes
Watch it
thing you see on
collapse.
TV where they
Yeah.
vacuum your clothes and put them in. Yep, same exact thing. We're gonna create a vacuum within your
Right.
wound and around.
And
your foot.
that's what I was asking. Do
Yes.
we want to prep it to where we get a good seal?
Yes.
Okay.
I'm not trying to tell anybody their job. I'm
Well, you
just doing
should.
it for
No,
my
so
reference.
far, you haven't said anything wrong. So
All right. Now
we're
that's
walking.
gonna go on over.
Yeah. We're gonna
So
get
hang
over
over,
that. Right? So you can take this piece and place it right about there, and then let it come right in the middle with it. Though, you know what I mean? We got plenty of drape, so it's not like we're gonna have.
Over for it. Yeah.
And
So
then press it onto the foam first, not on the side. So you come right up the middle. We don't want it to. Okay, now get your one underneath and run underneath and pull it,
Pull it as you like press it.
and then roll down as you go. There you go, right down the middle. Okay, wait, pull this off. Here. Let's get that off. Get it straight as you can. Good. Okay, now push your blue tab out of the way. Okay. Now press your sides down. You got to try to see if you can pull this out. Wait.
Yeah.
You can get this out a little bit. There you go. Okay. Now just come down on your sides like that, right down the edges. Yeah, just like that. Like you're going down the side of the cliff, not necessarily tacking it out on the outside. Okay. Now take your two, hold the blue tab down, and gently bring the two out because you don't want to disrupt what you just did. So we're going to take the two, and we're going to bring it out. Good. And pressing down as you go. Sorry. Just keeping it down. Good. And then just kind of push it around his toes. And we can always just take little pieces and fix it up a little bit.
Okay. Rip this off now.
Yep, and now rip that off. And then we're going to do the same thing heading up that way.
All right.
Well, we need another piece of foam.
Now, the other thing you can do with this that helps your seal in this situation is when you're done, just take your gauze, like your almost like a precast kind of thing, and
Yeah.
just wrap it. Just wrap it so this is covered with just so it's holding everything in place. It doesn't have to be visible to work. It can
Okay.
be held together, like a lot of guys do shoulders, or they'll do an elbow. They'll put it back on an elbow, but
Okay.
because of this, that people move a lot, you can just wrap it with, like a gauze or something to keep it in place. We'll see. Now, I
So
would
does this have
actually,
to
I
go
would do,
on top?
I would do that. I always like to put
Okay.
it on top. It doesn't really hurt anything because it's all going to collapse when you're done. But that way, we're guaranteed to have.
Yeah.
Yeah, I'll do the whole
So
thing.
overlap it a little bit over here with the one.
Yeah,
That's enough. Don't
But
take
don't
it off.
pull
enough.
all
Now
the
flip it over.
Yeah,
Yeah.
there you go.
And lay it down, and then just touch it on the top of the
Oh.
foam first.
Mm.
Touch it on top of the foam first. Don't put the sides down yet. And pull your other one up. But you pull that
Pull
off
it
now.
off.
Touch the top of the foam. Because what we want to do is if this is your foam,
Yeah.
you want the drape to fall straight down. Because when you hit the vacuum, if you tent it,
Yeah.
it's going to pull. And you get like a pull on the pin. Whereas if you come straight down and then hit the vacuum,
It'll
it just suctions. It's the foam. You don't get quite as much
pull off
tenting.
the one.
Yeah, pull it towards you. Yeah. You can pull the edges. Right, it chafes the skin. It creates tension on the skin, correct. So if you just let it push down the sides instead of a tenting nature, then you'll get a nice seal. And then you can just,
Alright.
now in these areas where there's a curve, yes, yep, exactly. Cut a little hinge.
Yeah.
Cut it straight across and let it fall onto his leg. We've got a good seal around the foam, and that's all that matters. Flimsy drape beyond your, you know what I mean? Like if it's on the around the foam tight, you have some areas out here that aren't sticking. Doesn't matter.
Okay.
Doesn't really hurt.
Do you
He may
retake?
have some pieces that aren't sticking. I got to take the
Yeah.
two off. But as long as you've got the seal around the foam, you're
Yeah.
getting good therapy.
Take that.
Mm.
I think this would be too much. Not trying to disrespect you,
It's
Steve.
a lot.
It's a lot.
You might want to talk about
What we want to
healthcare.
do is
I'm going to talk about a home. We have home vision.
You have it?
For these.
in,
Yeah,
in PG
Let's do one
County,
more.
Glendale, Maryland.
Now, when you set this up, you got the back here. Did you have anything that I can call the system and see what they put in for home health? Because usually there's home health.
So this wide, do you think?
Yeah.
Okay.
This is
Just to cover.
not saying you wouldn't be able to do it, sweetie, but
I know it's a
You need
lot.
two hands. You need people. She can help with home health.
Alright.
Right.
One off.
right.
Well, let's start taking off first. And go to the end.
No, you create a stricture. So if you wrap the drape completely around, you almost create a tourniquet. You cut off blood supply. Yeah. So you want to always have an edge of open channel inside. Never go around a limb, ankle, arm, wrist, even stomach. We have people that do big paniculectomies. You don't want to go all the way.
What is the normal? I shouldn't say normal because I'm abnormal.
Yeah.
The average
Take two.
time.
For something to heal like this.
Yeah.
Obviously you had issues with healing, whether it's I don't know if your
But
peripheral
now,
blood
see,
supply.
now,
3 to
now, see, if he
5.
slices me
Right.
and stitches, it works. It
Yeah.
closes. I mean, like
You've got good blood flow.
I got great blood flow. It's
In this situation, it's going to be a couple weeks to 3 to 5. And then,
okay.
But I think you should be okay. It shouldn't be longer than that because it's not a big open wound.
Right.
It's got sides. It's bloody. She was cleaning it. There's blood flow.
Right.
So-
That's what I'm saying. It's not like I have lack of.
Just grab it, pinch it up, and then cut underneath my fingers. That would be a good starting point for you. That's what I was doing. I know I got at least a good, decent hole. Yep, I'd cut a little bigger than that. Just get a little extra. I try to use an analogy as much as like the Dunkin' Donuts straw, those big daddies you get when there's coladas. That
I mean,
straw
those
compared
Slurpee
to a
straw.
coffee swizzle,
Yeah.
the bigger hole you make in there, the more suction you're going to get. If you make a little tiny hole, you're just going to get. It'll be a
I
good
just look at it for the vacuum on the engine.
Yeah, it'll be bigger the tube, the more power you're going to get. So it'll seal, but it just won't be getting that. Especially if we're doing this bridge, we're going to be sucking through this foam to
You're
your
going
wound.
twice as far as you need.
Yeah, it's not directly there. It's just so you can put down on your foot. We're probably going to have a little bit of a leak here. Well, I would just put one strip on the bottom there before we kick in.
Alright, let me take a quick. Okay. So then you cut through.
Yeah, I don't know if this is big enough. Is this big enough?
Yep, everything's normal now.
I'm not normal.
Oh, okay. That's got a little tab on it too. Okay. Ah, I see.
It goes right over the hole.
Okay, cool.
This comes in.
Okay.
You've got a plug here, just like any old anything that plugs in. It's got a little adapter. Just plug it in the wall and keeps the battery good.
Does it matter which tab you pull first?
This is supposed to come off.
You've got a nice little reading guide. You'll sit down and just look through your book, and it's really straightforward. The machine will tell you everything. If anything goes wrong, it'll beep. it'll say leak detected, and that means there's something there from around the sides.
Right.
We'll know in a second here if we got to
Yeah, and the blue part's supposed to come off.
What?
The blue part, and
Yeah.
it comes off.
Yeah, it will. It won't even look like it's peeling off, but just peel it back. It's there. Trust me. It looks like it's hard. It's not like the other one.
Oh, okay.
It fools people because you don't see the.
Okay.
Very cool.
Okay, so we're just looking at your leak rate. It's going to keep suctioning. It's trying to get to 125.
Want me to forward it to you?
Seriously, yeah.
We can actually start doing it.
Yeah, I mean, I should see it going down.
Yeah.
We can help it along.
That looks really bizarre.
Vacuum directly on the.
You can, but they said you didn't want to put it right there for
Because
some.
if he
Weight
puts
bearing,
any weight,
yeah,
then this
weight
whole
bearing,
thing's
you
gonna
can't
be.
do it.